Hi, I'm Ed Highland, and this is ASA TV. I've got the honor now of being joined by Dr. Jeffrey Plagenhoef, and you are going to talk with us about the questions. There's so many questions when it comes to ASA, but these are questions that members really need to know, really need to ask. And the first one, we want to talk about working toward professional citizenship. Why is that so important?
That is as important as taking good care of patients because it addresses everything that we do. It protects patients. So professional citizenship is defined as accepting personal responsibility for the current state and future state of something. In this case, we're talking about professional citizenship within our specialty, and we need more people to do more than they're doing. People have a fantasy that just going to the operating room and taking care of patients every day will be enough. If you have a realistic view of what's going on at the local, state, and national level, you'll see that decisions are being made by non-physicians to re-engineer the future landscape of healthcare. So we can go to our operating rooms and be the best anesthesiologist in the country every single day while somebody else is changing the rules by which care will be delivered. We know through the work that we do and the research, solid research, that we make a difference. It's very important that we be there. When something goes on in the perioperative arena and you're dealing with, say, hemorrhage or an anaphylactic reaction or a cardiovascular collapse, you're not practicing APRN anything. You're practicing critical care medicine that requires the highest level of care, the greatest knowledge base, the greatest technical skills to intervene when seconds count to make a difference for the patient.
Doctor, if you would, could you give us some ideas here? The physician-led anesthesia team, the VA has some proposed changes. Could you talk a little bit about those changes and what they might mean to the anesthesia team?
Yes, that's a very, very important topic. Our highest priority, as a matter of fact, over the last couple of years. We found out in 2013 that some people within the Veterans Administration thought it would be a good idea to give all advanced practice registered nurses complete independent practice, no oversight by physicians whatsoever. Their goal was to improve access to primary care. That might make sense, but the way they wrote it would imply that any nurse practitioner, clinical nurse specialist, nurse anesthetist, or nurse midwife could practice independently anywhere. They didn't name the environment. So you could have nurses providing independent care to patients, could be your family member, in an emergency room, in an operating room, or in an ICU. The ASA, once again, saw this as a huge threat to patient safety, and most importantly, the threat was to our nation's veterans. The people who protected us are now potentially caught in the breach of unsafe practices. So we have been working to change the narrative on that and to educate the public.
Talk a little bit about out-of-network payments, if you will. Give us an idea of kind of where we stand and where we're going in 2017.
Great question. That's another hot topic. The majority of people know nothing about it. It's being mischaracterized. The problem is being mischaracterized by the media, by patients' rights groups, and by the insurance industry. They're calling them surprise bills, and they're blaming greedy doctors for creating all these nasty surprises for patients, when in fact what's going on is we have gaps in insurance coverage. If you look back and see what's happened to the insurance industry, this is a problem created by the insurance industry, made worse really by the Affordable Care Act. What we have is that as the insurance companies are narrowing their networks, meaning the number of providers that they will allow to be in their network is being contracted more and more and more. In addition to narrowing the network, they're tiering these networks. So they'll have a platinum plan, a gold plan, a silver plan, and a bronze plan. And while one provider may be in network in the bronze plan, you find out that you're not in network in the gold plan. You tell the patient that, yeah, I'm in network with health insurance company A, B, or C, but then due to these changes that the insurance companies make in their tiering, we don't know. So we've got very, very complicated insurance these days. The average person doesn't understand it. We know that for sure. My wife and I had an experience with a balance bill, so I know this problem personally. My wife is president of the Texas Society of Anesthesiologists, and she's been working on the out-of-network front for about a decade. She needed a procedure with she and I, two national experts on this topic, asking both our health plan and the hospital all the questions that we needed to assure that we wouldn't have a surprise. We were told that our bill would be $150. So we thought, that's wonderful. And they said it was women's preventative health and that it would all be covered. So we have the procedure done, pay our $150, and 6 months later I got a bill for 12 times that, $1,800, because the health plan themselves didn't understand the product that they sold us, and the hospital couldn't understand it either. So insurance has been made extremely complicated. Patients don't know what they're being sold by the insurance companies or provided with by their HR department at their employment office. And they get their insurance, and when they really, really need it, they find themselves facing a gap in insurance coverage. So define, just in case people don't understand what it is, the out-of-network bill is the bill that is the difference between the bill that the patient, or excuse me, that the physician has for the service and what the insurance company will pay. And the insurance company just decides whatever they want to pay, and they leave a gap there.
How is ASA working to change that, raise awareness about the problem? I mean, if experts are having problems, what's average Joe going to have?
That's a great question. So last year we saw that really nobody was taking a leadership role in this as physicians, and more importantly, for those who were involved trying to help out legislatively, we weren't coordinated. So the American Society of Anesthesiologists reached out to the American College of Emergency Physicians, and we asked if they'd help us form a leadership group on this topic. And we did that, as a matter of fact, back in January. We had a face-to-face meeting in Washington, D.C. in May, where we had the AMA, the American College of Surgeons, the oral and maxillofacial surgeons, the radiologist, the pathologist, ER medicine, orthopedic surgery. We all sat down at the table, worked on a set of consensus guiding principles, and we're working on model legislation as well. So now we physicians are getting involved to advocate for our patients. We know through surveys that patients want their doctors to fix this problem or help them fix it. And that's what we do. That's in our DNA. We want to help our patients. So we are getting involved to fight against what's really going on and to put the proper narrative on the problem. This is a gap in insurance coverage that is hurting patients.
All right, Doctor, if you would, we've talked about professional citizenship, we've talked about physician-led anesthesia, we've talked about out-of-network payments. Can you tie all this together for us when it comes to these advocacy issues?
Sure. So I mentioned in the beginning about professional citizenship, and if we don't show up to provide the information that's needed, decisions will be made without all the facts. Bad decisions that could negatively impact patients, negatively impact veterans, negatively impact payment through out-of-network billing decisions being made by people naive to the reality of what's going on. So in this case, we need more anesthesiologists giving money to support our advocacy, giving money to their state political action committees and our ASA PAC so that we develop relationships with the policymakers, the legislators that are making these very, very important decisions. On the out-of-network billing, once again, policymakers and politicians are going to decide what's going to be done. They listen to people who come and present the case. If physicians don't present the case, then the false narrative from the insurance company will be what determines happens.
Excellent information. Dr. Plagenhoef, thank you so much for joining us.
Thank you.
And this is ASA TV.